Chapter 21, Clean Air. Is it safe to breathe? We breathe air every second of every day, but how clean is it? Air pollution is one of the leading environmental threats to public health. It contributes to asthma, heart disease, strokes, cancer, and premature death. In this chapter, we explore how public health monitors air quality, regulates pollutants, and battles the long-standing tension between public health and industrial progress. A brief history of air pollution. Let's go back to 1948, Donora, Pennsylvania. A thick industrial fog trapped toxic emissions over the town for 5 days. 20 people died, thousands got sick, and America woke up to a deadly truth: air pollution kills. The real shift came in 1970 with the Clean Air Act, a landmark piece of legislation that empowered the EPA to set national air quality standards and regulate emissions from factories and vehicles. The six criteria pollutants. The EPA identifies six major pollutants that are especially harmful and widespread. First is particulate matter, tiny solids that get into lungs and bloodstream. Second is sulfur dioxide from coal burning causes acid rain. Third is carbon monoxide from cars, reduces oxygen in the blood. Fourth is nitrogen oxides, cause smog and respiratory problems. Fifth is ozone, good in the upper atmosphere but bad at ground level. Sixth is lead used to be in gasoline, still found in some soil and dust. These are called the criteria pollutants because they are used to evaluate air quality across the US. Particulate matter, the most dangerous. Of all the pollutants, particulate matter is considered the most harmful. Why? Because these tiny particles penetrate deep into your lungs, enter your bloodstream, trigger heart attacks, strokes, and lung disease. There are two types: PM10, larger particles like dust and mold. PM2, 5 tiny particles from combustion that pose the greatest health risk. Measuring and monitoring air. Air quality is tracked using the Air Quality Index. The AQI measures how polluted the air is in a specific area on a scale from 0 to 500, to 50 E good, 50 to 100 E moderate. 101 to 150 equals unhealthy for sensitive groups. 151 plus equals harmful to all. The EPA works with state and local agencies to monitor pollution and issue warnings. Industrial sources and regulation. Where does this pollution come from? Mostly power plants, vehicles, factories, construction sites. The Clean Air Act required industries to use technology that reduces emissions. Over time, this led to cleaner cars, reduced smog, lower lead levels in air. But regulation is always a balancing act: economics versus health. Indoor air pollution, the hidden threat. Think indoor air is safer? Not always. Indoor air can be polluted by tobacco smoke, mold and mildew, household cleaners and pesticides, radon gas, asbestos and formaldehyde in older homes. And in developing countries, indoor air pollution from wood-burning stoves is a leading cause of child illness and death. Political pushback and progress. Air quality has improved dramatically since the 1970s, but progress hasn't been easy. The Clean Air Act has faced lawsuits, rollbacks, industry resistance, funding challenges. Still, deaths from air pollution in the US have declined, and environmental enforcement continues to be one of the EPA's most impactful roles. The climate connection. Air pollution isn't just about breathing, it's about the climate too. Greenhouse gases like carbon dioxide and methane trap heat in the atmosphere and worsen the impact of other pollutants. Public health is now part of the climate conversation: reducing fossil fuel use, supporting cleaner energy, protecting vulnerable populations from heat and poor air. Conclusion. Clean air is a basic human right, but it isn't guaranteed. Public health works to monitor air quality, educate the public, advocate for policy, push for environmental justice. Because whether it's smog in a city or smoke from wildfires, we all breathe the same air. Call to action. This video is based on Chapter 21 of Introduction to Public Health by Mary-Jane Schneider, 6th edition. If this helped clarify why clean air is still a public health priority, share it. And in the comments, let us know: what air quality challenges does your community face?